The first step in the fertility journey is usually to try and find out what might be wrong, and we arrange a fertility MOT in the case of a heterosexual couple, which will look at both the egg reserve and the sperm count and quality. For the egg reserve test, we will ask you to come for an ultrasound scan where we will look at the ovaries and the uterus. All the eggs are made before you're born, and we're not able to measure the exact number of eggs you've got left, but what we can do is see how many of your eggs are awake at any given time, and we know that that's proportional to the stock of eggs that you've got left. So we do something called an antral follicle count. We basically measure the small little sacs that are in the ovary that contain awake eggs. They appear as little black circles on the ultrasound scan, and the test takes around 10-15 minutes. We also measure a hormone in the blood called anti-Müllerian hormone, and that is proportional again to the number of awake eggs you've got in your ovary. And normally we find the antral follicle count and the AMH level are fairly similar. They don't measure egg quality. These tests are measuring the number of eggs we're likely to get if we were to do something like IVF and give you fertility injections. But I think the most important reason to do the test is to see if your antral follicle count and AMH are where they should be for your age, because we know that fertility does decline with age, and if your levels are a little bit below where we'd expect them to be, that might be a reason why it's taking longer to conceive, or it might be a reason why you want to get on and start trying to have a family. Alongside that, we also measure a hormone called thyroid stimulating hormone, and that's a useful marker because we know that the levels need to be at a certain level to reduce the risk of you having a miscarriage. For the man, we will ask you to have a sperm test, and that requires producing a sperm sample after ejaculation, normally having abstained for 2 or 3 days, and we then pass that sample into the laboratory where under the microscope our embryologists or scientists that work in our laboratory will be looking at the sperm count, how well the sperm are moving forward, and whether the shape of the sperm is normal. Now, there may be some low count or low motility or a particularly high level of abnormal shapes on a single sample, but that's just a snapshot in time. So if we don't get a very good result initially, we will try to talk about your lifestyle and other factors that might influence it, and potentially do another sample 3 months later, because it takes about 3 months to make sperm. Following on from your fertility tests, we'll arrange for you to have a consultation with one of our fertility experts. And during this consultation, which can be virtual over Zoom or Teams or face-to-face, we will go through your medical histories, we'll go through any medication you're taking, any family history that's relevant, any lifestyle issues that might be relevant to either of you, particularly things like alcohol intake, smoking, recreational drugs. And we'll try to look at what we can do to try and optimize your chances of conceiving. Now, for some, that might be modification of lifestyle and perhaps looking at frequency of intercourse and, seeing how things go over the next few months. For others, there might be a very clear-cut diagnosis. And for others still, there might be a need to carry out further tests, either on the woman, such as a test called a Hycosi test, to see if the fallopian tubes are healthy and open or whether they might be blocked, or potentially for the man, a further, more enhanced male fertility test or a repeat of the original sperm test or semen analysis. Either way, we're just trying to find out what's wrong, because understanding what's wrong, having an explanation, is a really, really important part, we feel, of moving forward to be able to plan any treatment if treatment is the way forward for you, or to reassure you that there isn't particularly a problem.